Good morning, everyone. It's truly an honor to be here with you today as we talk about an issue that is close to my heart: the well-being of our youth and families. Active leadership in fast-tracking family planning and adolescents and youth sexual and reproductive health, o AYSRH. Outcomes is not just a program, it's about creating a future where every young person, women, and men in Iligan has access to the care, guidance, and opportunities they deserve. Leading with purpose for Iligan. I was born and raised in Iligan. This is where my dreams were formed, and I learned that true leadership is about service, not status. My public service is deeply personal. My leadership journey is rooted in compassion for people and a strong belief in inclusive development. Before becoming mayor, I served in the House of Representatives, advocating for legislation focused on education, youth empowerment, and local economic development. However, returning to serve as the mayor of Iligan provided me with a direct platform to create meaningful change at home. My leadership is characterized by the ability to connect with people at all levels. Listening is the most powerful tool of a leader and embodies this philosophy by engaging with communities, listening to residents, and collaborating with barangay officials to co-create solutions. The cornerstone of my leadership philosophy is inclusive governance. In my administration, Iligan has introduced programs that actively involve women, youth, indigenous communities, and vulnerable sectors, not merely as recipients, but as partners in progress. Leadership is not only visionary, but also results-oriented. Together with other leaders in Iligan, we secure budget allocations for long-term programs, integrates data systems, and collaborate with national and global stakeholders to ensure that plans are translated into action and policy. In 2022, Northern Mindanao recorded a notable highest percentage of women aged 15 to 19 years who had never been pregnant based on NDHS. This alarming trend has raised serious concerns for the city. Amid disruptions in maternal and reproductive health services, Iligan has experienced a concerning trend in adolescent reproductive health outcomes. The adolescent birth rate, or ABR, dropped from 46 in 2020 to 29 in 2021, surpassing the target. However, in 2022, the ABR rose again to 42, once more exceeding the target. This fluctuation underscores the pandemic's impact on young people's access to reproductive health education, services, and support. The other graph illustrates the modern contraceptive prevalence rate, or MCPR, among women aged 15 to 49 years in Iligan City from 2020 to 2022. Compared to the target of 30%, the MPCR has increased by 1 percentage point per year, indicating steady progress. We aim to accelerate our efforts to implement effective strategies that will sustain and enhance these gains. In 2023, I initiated the Iligan City's entry into the Challenge Initiative, or TCI, a global program co-managed by the Swillig Family Foundation and the William H. Gates Senior Institute, in partnership with the Department of Health, Center for Health Development, Northern Mindanao, and the Commission on Population and Development. TCI empowers local governance, TCI empower TCI TCI empowers local governments to accelerate and sustain effective family planning and adolescent sexual and reproductive health o ASRH solutions through strong local ownership. To champion inclusive and participatory governance, we adopted a collaborative leadership model that actively involves stakeholders from grassroots communities and the private sector in designing, implementing, and evaluating health development programs. Through Executive Order Number 28, Series 2023, we formalized the City Leadership Team o CLT, a multi-sectoral coalition committed to ensure that Iligan's health services are adolescents-friendly and responsive. The CLT leads initiatives focused on workforce development, facility enhancement, and capacity building to drive sustainable health improvements across the city. We partnered with academic institutions like Adventist Medical College to better understand the challenges health workers face in reducing teenage pregnancy in Iligan City. Researchers conducted a study in 4 barangays, Tambacan, Tipanoy, Santiago, and Abono, and generated valuable evidence that strengthens our adolescents' reproductive health programs. Their findings offer actionable insights that allow us to design smarter, more efficient, and sustainable approaches tailored to the realities on the ground. This research initiative supports the Challenge Initiative's TCI High Impact Interventions or HIIS, ensuring that our strategies remain evidence-based and context-responsive. Through this partnership, we continue to accelerate efforts to reduce teenage pregnancy and improve youth health outcomes in Iligan. Dr. Glenn Managpaak, City Health Officer, emphasized the impact of TCI. The collaboration and ownership of the problem and its solution is a key contribution of the TCI program among us from the City Health Office, LGU, and other key agencies. He noted how it shifted the city's approach from fragmented efforts to a unified strategic framework. Before TCI's engagement, interventions in Iligan were often fragmented, characterized by limited data disaggregation and minimal youth engagement. ASRH and FP were largely seen as a responsibility of the health sector. With TCI's coaching and technical support, however, planning and implementation have become more evidence-based, participatory, and inclusive. Youth, women, and community leaders are now actively involved, and the principles of gender and development has been mainstream across FP and ASRH programs. I have made it a priority to strengthen our family planning and adolescent health services. We have increased budget allocations to support logistics, capacity building, facility improvements, and demand generation activities because we believe every individual deserves access to quality reproductive health care. Together with TCI and CFF, CPD, RO10, DOH, CHD, NM, and our city leadership team co-developed the 2023 to 2025 program design to guide our efforts. This comprehensive program now drives the implementation of high-impact interventions and evidence-based strategies. Through it, we aim to reduce teenage pregnancies, enhance our service delivery system, and expand access to modern family planning methods to every community in Iligan City. I take pride in how our city leadership team continues to strengthen our health systems through meaningful data-driven action. We reoriented the training to improve nurses and midwife skills in recording and reporting family planning data. Participants received updates on the 2018 FHSIS version, practice using standardized forms, and completed simulation exercises to generate the FPM1 report. We also provided hands-on training in data quality check or DQC processes and introduced changes to FPM1 reporting per DOH Memo 2023-0071, and this effort reflects our broader commitment to competency-based family planning services. By investing in continuous coaching, mentoring, and system improvements, we are building a strong foundation of accurate and reliable data. This empowers us to deliver high-quality, right-based reproductive health services that truly meet the evolving needs of our people. I am committed to championing youth inclusion in health and governance. We are expanding our services and implementing policy reforms prioritizing young people's well-being. We have strengthened our data systems and streamlined our referral network to deliver integrated adolescence-focused services, including adolescent sexual and reproductive health or ASRH, mental health support, substance use prevention, and child protection. As a result, we have established 19 Level 1 adolescence-friendly health facilities that offer youth-centered care from psychosocial assessments and family planning council and to HPV immunization and maternal health services. In partnership with the Commission on Population and Development, the City Population Office, and the Department of Education or DepEd, we developed and promoted the SHAPE module. This comprehensive sexuality education program equips learners with the knowledge and confidence to make informed choices, empowering a healthier generation. We engage our youth through peer education sessions, youth summits, and community-based dialogues that create safe spaces for open conversations about reproductive health. As one young citizen, Maria Santos, shared, having our voices heard in these discussions makes me feel empowered. We need services that understand our needs. In addition to further institutionalize youth participations, we took a significant step forward by enacting Resolution Number 25-210. ICYDO collaborates with local organizations and the local Youth Development Council to ensure that adolescents have direct access to accurate health information and essential services. By working closely with trusted sources, we ensure our young people receive information that is timely, relevant, and tailored to their unique needs. As Ms. Nora Fe Escorial, our local youth development officer, emphasized, by providing direct access to trusted sources, young people receive information tailored to their needs. Through this bold move, we affirm that youth voices matter, not just in discussions but about their well-being, but in decision-making spaces where policies are created. We prioritize sustainability in Iligan City's health strategy to ensure lasting progress. By increasing our health budget and institutionalizing positions for trained health personnel, we are building a resilient health system that meets our people's evolving needs. We are establishing two family planning standalone clinics to improve reproductive health services. These clinics will enhance access to modern family planning methods and provide financial protection for women and families, empowering them to make informed health choices. We continue to expand the CADA network, a platform for adolescents empowerment and youth-led advocacy. This network is essential in reducing adolescents' pregnancies, promoting life skills education, and ensuring young people can access necessary care and support. Latest data shows a promising decline in the adolescents' birth rate from 2023 to 2024, accompanied by an increase in modern contraceptive prevalence rate. These positive trends emerged following the launch of the Challenge Initiative in partnership with DOH, CHD-NM, and CPD RO10 in Iligan City. Clear evidence that our community-driven approach is effective. These results affirm that investing in people-centered, youth-friendly services and strengthening our local systems creates a real impact. However, adolescent pregnancy remains a challenge that requires our continued focus and collective action. With the unwavering commitment of the city leadership team and the support of our health workers, partners, and communities, we will sustain and scale these gates. Together, we are building a future that empowers families, especially our youth, ensuring that every young Iliganon can thrive, healthy, informed, and hopeful. Daghang salamat.